The healthcare system is teetering and at times has been pushed over the brink. And that includes both our ability to deliver care and the health of the people within the system. So I think this new variant is just a reminder of how fragile the system is and our need to really continue to follow public health guidelines. The real thing we have to ask ourselves is, was the baseline we were at even good enough? You know, Canadians were facing long wait times to access care pre-pandemic. Now that's worse. We're also facing a human health resource crisis. So I think it's really critical that all levels of government come together to understand this problem with us and commit to taking action. This report really makes it clear the crisis that is facing Canadians and our system. You know, so many people have been impacted directly by COVID, but what we're learning today is many Canadians have had very significant health impacts outside of COVID as well. It's broad-reaching. It's backlogs in surgery, it's mental health, it's deaths from substance abuse, and it's things like social determinants of health with almost a 40% increase in food insecurity. So I think there's really no one untouched by this pandemic. There's no health without healthcare workers. We saw legislation being proposed last week to actually put things in place to prevent the violence that's happening. And we also need the governments to continue to invest in our health workforce so that we can continue to do what we do best, which is care for Canadians. It was certainly encouraging to see a throne speech that centered around creating health and wellness for Canadians. I think what's less clear is, are the commitments going to be there to actually achieve that? Some of it is related to dollars and investing in our system. Some of it is related to supporting the human health resources we have. And some of it relates to actually modernizing our system so it can meet the needs of Canadians.